Hi, this is Nell Tharp. We're going to talk today about the anatomy you encounter during a C-section, and we're going to go through it layer by layer using this foam and fabric model. So the first layer that's encountered is the skin. The incision can be curvilinear like this one, or some surgeons will make a straight incision. Depends on whether they're doing a fan and steel incision or a Joel Cohen type incision. Underneath the skin, you'll see the subcutaneous layer. The subcutaneous layer is yellow. It can be pale yellow, it can be orange, it can be grainy, it can be oily. There's quite a bit of variation. And it can be thick or thin. In this instance, it's about 1 centimeter thick and would be easily cut through. And I'm going to remove this layer to help us see the next layer, which is the fascia. So the fascia is a thick type of connective tissue, and it surrounds the rectus muscles. So I'm just going to give you a peek down here to see the rectus muscles on each side. The rectus muscles are divided in the middle, and the anterior fascia and the posterior fascia actually fuse in the middle in what's called the linea alba. The fascia also has a number of nerves and blood vessels that run from underneath up through the subcu and up to the skin, and these are represented in this model by these little Velcro bits, and the Velcros that go up and down represent the linea alba. When we're having a C-section performed, the incision in the rectus fascia is typically a transverse incision. Once it's opened, and we're just going to show the anatomy now, not any of the techniques, you will be able to see the rectus muscle. Behind the rectus muscle, after you get through this linea alba, will be the posterior rectus fascia, but you don't actually see it during the course of the C-section. So just to demonstrate this, I'm going to do something that you can't do on a normal body, which is show you the backside. So this is what the rectus fascia will look like in the posterior area, and it will be split in the midline as the rectus muscles are taken apart. And we'll show those techniques in a little bit. Once the rectus fascia has been opened and the rectus muscles have been separated, we'll then encounter the parietal peritoneum. This is a thin filmy layer that lines the entire abdominal cavity, so it's on the outer aspect of the abdomen. And it will typically be tented, palpated to make sure there's no structures underneath, and then opened either through blunt dissection or sharp dissection to expose the uterus. And the uterus will have the body of the uterus up top and the lower segment, which is what thins during the course of labor. Once the abdomen has been entered, you'll also be able to see the vesicouterine serosa, and this is the juncture of where the bladder lays on top of the uterus. This is an important landmark during the dissection, and it's important to note where the bladder is so that it can be maintained in an intact status during the course of the surgery. And then the incision is typically made in the lower uterine segment so that it's in the less vascular area. So that's the general anatomy that's encountered during the course of a C-section. Please use your anatomy resources to explore the details of this anatomy further, and we're going to follow up with some short videos that show the dissection techniques that you can use during C-section when you're acting as the first assistant. There are a number of different techniques, and I hope you'll enjoy those videos as well. Thank you.